Hi, this is Rick Hutchinson from Doane University, and I'm going to take a couple of minutes to talk to you about biofilms, their formation, persistence, and interaction with the host immune system, which has created a problem within modern day medicine. Biofilms are implicated in intractable urinary tract infections, in lung infections such as cystic fibrosis, also on the teeth, on implanted medical devices, and those are only a few scenarios. It's noted that nosocomial or hospital-acquired infections are the fourth leading cause of death in the U.S., and biofilms contribute to the failure of antibiotic treatment, particularly in hospital patients. And we've seen that a lot as patients come out of the hospital with certain types of implants, whether it be hardware in their skeletal system, or if they've had a pacemaker installed, or whatever device is foreign device is integrated into their normal anatomy, that these biofilms can form and create this persistent resistance to penetration by nutrients and antibiotics. So here's a picture of bacterial matrix that is in contact with living tissue, as you see here. It's not a great picture because it's in black and white, but please note the structures of the biofilms, as you can see here, that are created within the living tissue or on the outside of the living tissue. And basically what these do are creates a shield, and the whatever type of infection can harbor underneath these this biofilm, this polymer coating on the outside of different types of implants, or if, for instance, in cystic fibrosis, where this fibrous tissue is formed inside of the lungs, and also in other types of implants, such as in dental implants and things like that. And that creates a big problem, especially when you're dealing with different types of superbacterias, such as MRSA, and vancomycin, VRE, vancomycin resistant bacterias, and some of these other super infections that have developed because of their adaptation to antibiotics. So here's a biofilm formation, a grid or an outline of basically what's happening. We've got planktonic bacteria, that's free-swimming bacteria, can reversibly attach to different types of surfaces, and that's basically what happens is it creates that coating to its auto-aggregation. Bacteria transition from reversible to irreversible attachment due to EPS production. So that would be the extracellular polymeric substances. So you've got the EPS production, and then you've got establishment, early development of biofilm architecture into a stable supercellular structure. So this is actually a formation of that structure on the outside, or protective layer over top of devices, or sometimes fibrous tissue or implants, as previously stated. And fourth, you have the growth, the late development of microcolonies or multi-species of secondary colonization by multiple species, which can occur. And the sanctuary that happens underneath, which is impenetrable in many cases by modern day antibiotics. So that creates a real problem within medicine. And so that's a little tutorial on biofilms and an introduction into it, and basically what we see in medicine as a result of this type of complication. So thanks a lot for listening. I hope you enjoyed the brief synopsis on biofilms, and picked up something along the way. Thanks a lot, and have a great day.